Welcome to the Good Nursing Practice podcast, where we share insights and tips from nursing professionals and experts on how to provide safe and effective care to patients. I'm your host, Jane Doe, and today we're going to talk about some of the principles of nursing practice that guide our work as nurses. According to the Royal College of Nursing, there are 8 principles that apply to all nursing staff and nursing students in any care setting. These principles describe what everyone, from nursing staff to patients, can expect from nursing. They cover the aspects of behavior, attitude, and approach that underpin good care. The first principle is that nurses and nursing staff treat everyone in their care with dignity and humanity. They understand their individual needs, show compassion and sensitivity, and provide care in a way that respects all people equally. This means that we listen to our patients, respect their preferences and choices, and protect their privacy and confidentiality. The second principle is that nurses and nursing staff take responsibility for the care they provide and answer for their own judgments and actions. They carry out these actions in a way that is agreed with their patients, and the families and carers of their patients, and in a way that meets the requirements of their professional bodies and the law. This means that we are accountable for our decisions and actions, we document our care clearly and accurately, and we report any errors or concerns promptly. The third principle is that nurses and nursing staff manage risk, are vigilant about risk, and help to keep everyone safe in the places they receive health care. This means that we assess and minimize potential harm to our patients, ourselves and others, we follow infection control measures and safety protocols, and we speak up when we see something unsafe or inappropriate. The fourth principle is that nurses and nursing staff provide and promote care that puts people at the center, involves patients, service users, their families and their carers in decisions, and helps them make informed choices about their treatment and care. This means that we communicate effectively with our patients and their loved ones, we involve them in planning and evaluating their care, and we respect their right to consent or refuse treatment. The fifth principle is that nurses and nursing staff are at the heart of the communication process. They assess, record and report on treatment and care, handle information sensitively and confidentially, deal with complaints effectively, and are conscientious in reporting the things they are concerned about. This means that we use clear and appropriate language with our patients and colleagues, we record our observations and interventions accurately and timely, we handle complaints professionally and constructively, and we escalate any issues or incidents that need attention. The sixth principle is that nurses and nursing staff have up-to-date knowledge and skills, and use these with intelligence, insight and understanding in line with the needs of each individual in their care. This means that we keep our knowledge and skills current through continuing education and professional development, we apply evidence-based practice to our work, and we use our clinical judgment and critical thinking skills to provide the best possible care. The seventh principle is that nurses and nursing staff work closely with their own team and with other professionals, making sure patients' care and treatment is coordinated, is of a high standard and has the best possible outcome. This means that we collaborate and communicate effectively with other members of the healthcare team, we respect each other's roles and expertise, and we work together to achieve common goals. The eighth and final principle is that nurses and nursing staff lead by example, develop themselves and other staff, and influence the way care is given in a manner that is open and responds to individual needs. This means that we act as role models for good practice, we support and mentor other staff, especially new or junior ones, and we advocate for quality improvement and patient safety initiatives. These are the 8 principles of nursing practice that guide us as nurses in providing safe and effective care to our patients. They are not only standards that we have to meet, but also values that we have to uphold. By following these principles, we can ensure that we deliver care that is dignified, responsible, safe, person-centered, communicative, knowledgeable, collaborative and leadership-oriented. Thank you for listening to this episode of the Good Nursing Practice podcast. I hope you found it informative and useful. If you have any questions or comments, please feel free to contact us at goodnursingpractice@gmail.com. We would love to hear from you. Until next time, take care and keep up the good work. Thank you for watching. Please subscribe for more video.